morning po.
Morning po.
I'm Nurse Yen and you are?
Education po.
So today I will be assessing your vital signs.
Then, perform medical hand washing. First is to wet hands with water. Then apply hand soap and rub hands palm to palm. Then left palm over the right dorsum with interlaced fingers and vice versa, and backs of fingers to opposing palms with fingers interlocked. Number 6. Rotational rubbing with fingers of the right hand. Then, rotational rubbing of the fingers of the left hand. Then the upper part of the wrist. And lastly, rinse hands with water. And then, dry hands with a tissue or towel and then dispose it. And then next step is to prepare the materials needed before assessing the vital signs. First is the auxiliary route. 1. Provide privacy. Assist the client to comfortable position. Then clean the thermometer using cotton balls and turn it on. Next, raise client's arms, insert the thermometer into center of axilla, and lower arm properly across chest. Then leave the thermometer for 1 to 2 minutes until you hear beeping sound. And then, while waiting, you can get the patient's radial pulse. Remove the thermometer and read the temperature displayed in digital window. Then, disinfect from stem to bulb using a cotton ball with alcohol, air dry and turned off, and put it back on its container for next use. And then, don't forget to document your findings. Second is assessing radial pulse. First, position the client's arm along the side of the body. Then place your first, second, and third fingers over the artery. Using a watch, count the number of pulsations felt for 30 seconds, then multiply it by 2. If the rate, rhythm, or amplitude of the pulse is abnormal in any way, palpate and count the pulse for 1 minute. And lastly, don't forget to take note of your findings. Third is monitoring respiration. First, keep fingers on the client's wrists, and then place the arm across the chest. Using a watch with the second hand, count the number of respirations for 30 seconds, and multiply this number by 2 to calculate the respiratory rate per minute. If respirations are abnormal in any way, count the respirations for at least 1 full minute. Note the depth and rhythm of the respirations. A complete cycle of inspiration and expiration constitute one act of respiration. And then document your findings. Measuring blood pressure. First, have the patient a comfortable position with the forearm supported at level of the heart and palm of the hand upward. Then wrap the cuff around the arm smoothly. Then place the stethoscope earpiece on ears. Place the bell of the stethoscope firmly with little pressure as possible. Then tighten valve on hand valve. Next, pump hand valve to 80 mmg above last pulse left. And then open the valve on the manometer and allow air to escape slowly. Note pressure at where it first regular sound and points of mottling in which sounds disappear. Remove earpiece from ears and cuff from the patient's arm. And then document your findings. So for the overall findings, note for the patient's name, age, temperature, pulse rate, respiratory rate, and blood pressure. Then perform again medical hand washing to get ready for the next patient. That would be all. Thank you.